All right. So welcome to our presentation today for Black Maternal Health Week on maternal health community-based organizations in New Jersey, landscape and opportunities. So my name is Cecile Edwards, and I am the Senior Manager for the Birth Equity Funders Alliance. I'll say Alliance after this, but as a Senior Manager, I'm happy to serve in collaboratively managing our portfolio and making decisions about funding priorities and creating and maintaining critical community connections, while also fashioning a learning agenda for the Alliance and our Community Advisory Committee to better and more deeply understand the landscape of birth equity as a whole in New Jersey and nationwide. It is a pleasure to be here and be serving in that capacity. So just to look at our agenda to start, we're going to start obviously with introducing the Alliance and then go into some details about the CBO landscape research with acknowledgements and background approaches and taken to methodology and our key objectives for this research. And then, of course, our key findings, the ecosystem of CBOs in New Jersey and the key challenges highlighted by CBOs. And then we'll go into a reflection activity just to discuss what you see in this, if you see any of your own challenges as a CBO, if you represent a CBO in this as well. And then for the last actual 10 minutes, 15 minutes, we're going to actually have the Office of the First Lady come in to say some remarks and share some insights as well. And then we'll close out for the day. So that is our lay of the land. So a little bit of background. Now this particular page was fashioned or created at the inception of the NJBF, and as we just discussed, these numbers have increased. So I believe it's from 47 women per 100,000 to 60 plus out of 1,000, the 2022 data shows. However, the number of times more likely in New Jersey still remains the same, as all numbers have gone up, but this has increased. And it is suggested that it has increased because of COVID complications with pregnancy. Either way, we know that it is far too high. And we know that in New Jersey, we are working with the Nurture New Jersey plan to help to eradicate these numbers and to create better numbers and create a safer place to give birth in New Jersey in general. So just to, again, give an overview of the Alliance. The Alliance originated in support of the objectives of the Nurture New Jersey strategic plan, which strives to make New Jersey the safest place and most equitable place to give birth and raise a baby in the United States. The Alliance aims to contribute to overall improvements in maternal health outcomes, including racial disparities. And in the spirit of collective commitment and action, we're leveraging individual strengths of the member funders and in service of our goal to achieving birth equity in New Jersey. So we seek to truly be partners to community, public sector, and community-based organizations in order to do that. And with that, that means that we must learn new approaches and unlearn approaches in philanthropy. The Alliance's guiding principles, which you see here, include a focus on racial equity, collaboration, learning, and mutual accountability, and co-designing solutions with the community. Our mission, our initial focus was to increase the availability of access to community-based services for families. And at present, the Alliance includes the following funders: the Burke Foundation, the Community Health Acceleration Partnership, the Henry and Marilyn Tao Foundation, Organon, Bristol Myers Squibb, and the Robert Wood Johnson Foundation. And please, if you have any questions, feel free to add them to the chat. So our vision overall is to reduce the maternal mortality rate in New Jersey and eliminate racial disparities, as we've stated. And our approach to change is to support BIPOC-led community-based organizations to deliver on and expand existing work by providing resources and connecting CBOs to systems and services. And so we have our intended outcomes and impacts, again, which we've discussed already. So why did we focus on community-based organizations? Community-based organizations, as we know, wield tremendous influence within communities and have demonstrated passion and perseverance, building momentum, sometimes with minimal external support and resources. So our idea was that CBOs would play multiple roles in creating birth equity in New Jersey through service delivery and innovation, awareness and advocacy, and connecting and strengthening systems. And so we wanted to ensure that we enhance that ability of CBOs through providing them support. Okay. So looking at the New Jersey CBO landscape research, I just want to start off with a little bit of background and acknowledgements. So as I stated, the mission is to strengthen the community-based sector. And our first step was to understand who is active in this space and their challenges and how we can support them. So we wanted to fill in that knowledge gap by knowing who the actors are, and then connecting with them. We want to acknowledge and thank our research partner. We selected Amaka Consulting and Evaluation Services, a women-owned consulting firm founded by Dr. Ndidi Amaka Amuta, to lead this landscaping research. And the objectives clearly laid out is that we wanted to accomplish 3 goals. As I said, discovering who the individuals are, providing perinatal services to people of color in New Jersey. We also wanted to center the voices of those who are closest to the lived reality of New Jersey's maternal and infant health inequities, as well as diverse voices within multidimensional birth equity workforce in New Jersey. And finally, to inform funders and key decision makers of the technical assistance and resource needs of CBOs. Okay. So this research in general represents community-based organizations' accounts of their experiences serving their target population. Okay, and the intention is then to turn these barriers that they face into solutions and pathways, working with them to do that. And of course, we want to acknowledge the CBO leaders and the subject matter experts and community leaders and members of the Community Advisory Committee. And our Community Advisory Committee stewards the fund that we use to create RFPs to issue funds to community-based leaders and taking their time to share their insights with the project team. If you were a participant in the survey or interview, please let us know in the chat. We'd love to acknowledge you and share that you are here. Well, let's look at some very key definitions here. And thank you all for introducing yourselves in the chat, by the way. Looking at these key definitions, for the purposes of this analysis, a community-based organization is defined as one that is driven by community residents in all aspects of its existence. This means that the organization has one or more of the following characteristics. The majority of the governing body and staff consists of local residents. The main operating offices are in the community being served. Priority issue areas are identified and defined by residents. Solutions to address priority issues are developed with residents. Program design, implementation, and evaluation components have residents intimately involved in or in leadership positions. And for the purpose of the study, people of color is defined as individuals who identify as Black or African American, Asian Pacific Islander, Native American, Hispanic, or Latinx. And BIPOC refers to Black and Indigenous people of color. Okay. So a little bit about the methodology, just noting that this was a mixed methods approach to the research. So it had both quantitative and qualitative data. And you'll note that you'll see some of the accounts, the summary of the accounts, but also some numbers. Total number of participants for the survey were 124. Over 90 birth equity organizations were identified through this research. And this ranges from doula agencies, social service agencies, community health centers, supportive housing organizations, and advocacy groups. Okay, again, just some more information about the survey respondents, their profiles and the industries they were in, and also the areas of New Jersey as well. So we can see that healthcare, doula care are the industries primarily represented. Morris County, Cumberland County, Bergen County, and pretty equal between Essex, Union, Hudson, Mercer, et cetera. Oops. Okay, so now we're going to get into some of the findings. Okay, so again, these findings represent the CBO's account of their experiences. And the individual's access to services is one area in which question was asked. So this discusses the clinical and social determinants of health services for birthing people who have gaps that are worse, and the gaps are worsening for people of color. Unfortunately, as we know, the most common services provided is health, education, and family programs. So those are readily available. The least commonly provided services are disability services, clinical testing, financial services, and legal services. Okay. And I know that one of the areas that we're looking to partner with the learning session for community-based organizations is the legal part, what is it called? The medical legal partnership to bring that information to doulas for their knowledge and understanding of how they can better access services, and also how organizations can provide those services and include them into their processes, because it is an important one for many reasons, as we have learned. Services in high demand: housing, transportation, and language assistance. And underutilized services are disability services, mental health services, and emotional support services. So we note also that addressing these challenges requires significant coordination between agencies and community-based organizations to ensure that clients are able to access them as needed. If you have any questions or comments, please feel free to share that in the chat. So some of the findings around the reasons for inaccessibility. One of the biggest reasons for inaccessibility is the lack of services where BIPOC and birthing people need them, followed by service providers' limited capacity to cater to new clients and clients' inability to pay for services. So here you'll see the reasons noted by the CBOs for inaccessibility is language barriers, inability to pay, limited capacity to take on new clients are equal in the amounts, and not providing service is the highest, the area where there's the highest inaccessibility. And other is the lowest, other wait list, and do not accept health insurance. Other includes legal services, for example, as we noted on the previous slide. So these testimonies from CBO community-based leaders is one to note, because we like to look at the testimonials as a way to truly understand the data. So looking at what was said, usually my clients feel comfortable with someone of the same cultural background, beliefs, and social context. Right. So this is something that has been noted in research outside of this as well, where we know that providers are being told that, they would like to have someone who, or CBO leaders are being told that they would like to have someone who understands their context, their cultural context. We cannot find mental health providers. We contacted mental health clinics that only serve Medicaid patients, and their wait list is 6 to 12 months long unless the patient is suicidal. And they have to complete intake as an inpatient, causing more barriers and stigma. Okay. So again, just providing context to these numbers and understanding what it is that is being experienced by community-based organization leaders when they are interacting with their target population. So why do these barriers to accessing services exist? Well, there's several things that have been found. One is the lack of trust in organizations coming into longstanding communities who may have had a history of being historically harmed by such relationships. And again, I think this goes back to the definition of community-based organizations and really ensuring that these organizations are rooted in the community and have a relationship with the community. Two, citizens, and why we should also promote and assist those who are rooted in their communities, right? Number two, citizen status of the large and varied immigrant communities served by organizations throughout New Jersey. So, just being mindful of the immigrant status, the immigration status of individuals. And I'm happy to say that one of our grantees from our postpartum equity support grant is someone who serves immigrant populations in her community. This is a critical step. Scarcity mindset. There's not enough funding available, or funding is time limited. So CBOs are interested in providing more services. And sometimes those services in birth equity, first of all, there's limited services around birth equity when it comes to RFPs that are issued to smaller organizations in particular, and their ability to access it. The barriers may be great for accessing those fundings. For example, the applications may be complex. There may not be enough time to complete applications because they are on the ground doing the work. Number four, simply not enough workforce available to tend to everything day to day in the larger picture. So as we know, in New Jersey, we are working on workforce capacity. And of course, those who are on the ground in CBOs certainly feel that the most because they would like to assist in the ways that they can assist, but do not have the capacity to do so, and are noting that here in this research. Clients are not able to afford any percentage of out-of-pocket costs, even if organizations are interested in exploring cost sharing. So cost sharing is something that community-based organizations, again, would be needing to do because they have to take care of their own lifestyle, right? And so, this goes back also perhaps to the funding availability and being able to receive funding to do services or complete services with their clients or target populations in a way that doesn't do harm to themselves. And yeah. Okay. So another part of the findings have to do with the challenges faced by community-based organizations. BIPOC-led community-based organizations shared an acute need for more staff capacity, staff well-being, and technical assistance. So as previously discussed, that staff capacity, BIPOC-led organizations cite limited capacity for writing grant applications, medical billing, and marketing and communications. Okay, so in order to keep your business going, right, you want to have the ability to raise more funds, get more clients, or be able to bill medically so that you can receive your reimbursements for that. And oftentimes you need staff that are able to do that, perhaps a grant writer, perhaps someone who deals with just the billing side of it in communications. Staff well-being is another area that we learned of, is the prioritization of support for addressing staff burnout and increased staff funding. So recently I read something where the burnout rate has doulas and community health workers turning over 18 to 24 months. So the turnover is quite rapid. And so how do we consider the need for more well-being support? Technical assistance. There's a need for communications and marketing resources among 501c3s to forge partnerships and continue their important work. So being able to connect with other community organizations, but also being able to share the work that you're doing in a way that amplifies it and causes interest is critical for any business, right? And then also visibility, all right? So what are some of the services that perhaps get least visibility? Infant loss and pregnancy loss organizations were identified as one, dual organizations, and organizations focusing on BIPOC individuals were noted by the CBOs as being least visible birth equity actors in New Jersey. And then we'll get to barriers, findings on the barriers to funding. So the first is the lack of awareness of funding opportunities. And again, the qualitative piece of this is sharing, you know, if I don't know that there is funding out there, then I'm not going to know, right? Because I'm doing this on my own. So, you know, if you're a one person show and you are, which many are, and you're doing the work, then, you know, knowing what the funding is, let alone being able to sit and fill out the sometimes complex applications can be quite a barrier. Eligibility criteria that eliminate application based on race leadership. So this one points to, when you're talking about community-based, it's based in the community, but the leadership is primarily not of color. What do we do with that consideration or that conversation? So our leadership is predominantly white women, older white men. So I don't know, just thinking of these grants that are coming for people of color, and they're saying that they want funding to go to organizations that are led by women of color. That may be a barrier. Is that also a barrier for the communities receiving services, right? And number three, a substantial amount of time and grant writer costs necessary when applying for funding. Again, talking about what the needs are in terms of writing grants and receiving funds, states here that, and then being able to take the time to apply for this funding, when I do hear about it, is another barrier as well. And then even following those things take time, right? So what does the application look like? Are all of the items in the application necessary for being able to issue funding? What is it that is really needed for these organizations? Need for formal documents, audited budgets, disadvantaged smaller organizations. Someone states, I'm also tired of seeing the same agencies funded. The same agencies keep getting state funding, and you're getting a lot, millions of dollars. There are other people, other organizations, small and large, that are doing great work out here. So just this idea that how do we trickle down, or how do we get the funds to organizations that are smaller organizations rooted in their communities doing the work. And that was shared among the community-based organizations as well. Barriers to reporting data. So we know that data collection is critical for funding organizations to receive. It was noted that small organizations, individual providers may lack the time or skills to gather data or produce measurable metrics that speak to their work. And so thinking about that as a consideration, sorry, I don't know why this keeps on moving, as a consideration, and perhaps building that into how technical assistance is fashioned. So the Alliance took that into consideration when looking at the priorities for building out a technical assistance process, and just looked at the various priorities, and were able to provide a solution for our grantees that would assist them with that process and teach them about that process. Client testimonials may be difficult to procure due to transient clients, multiple needs, and critical post-birth need periods. Another very great point about collecting data, what data even looks like. I know that in our first RFP, we added the section where you can add testimonials from clients. So that was a way for us to gather data about the work that individuals were doing in their organizations. And as this notes here in the purple, but it's really hard, to show the effectiveness when I'm just in it doing the work, right? And yes, I have my text messages and whatnot from my mom or client saying, like, I don't know what I would do without you, or you really like saved me, or like you are my saving grace to my pregnancy, whatever it is they're saying, but that's not enough, for funders. So again, taking into consideration, what does data look like? And how do you receive that? Limited know-how or capacity to navigate the process of pursuing 501c3 status prevents some organizations from accessing funding, favoring larger agencies. So we know that historically it has been difficult for other business structures or structures to receive funding. And it may be difficult to receive 501c3 status. And so how do we balance that or understand that in our funding process and priorities? And then bureaucratic processes, such as the volume of paperwork, a lack of assistance in filling out required paperwork, and lengthy approval times also present barriers as well. So respondents were really able to address the things that they saw in their work on a day-to-day basis. It really helped us to understand what the needs of BIPOC-led community-based organizations are. So just looking at a very quick view of the recommendations by the ACES team, our research partner, workforce development and support, funding for staff capacity building, diversity initiatives, and mental health support is critical for retention and delivering quality care. Other examples include providing training on equitable hiring practices and offering free or subsidized mental health services for birth equity workers. Okay, so thinking back to the data that we received about which services are least used and least out there for access, mental health services was one of them. And we also know that capacity building, funding, that general support is also oftentimes limited. Funding landscape analysis, exploring the barriers to access to funding to lever the power dynamics between larger and smaller organizations or individuals without support. To address these issues, conducting a landscape analysis specific to available funding, characterizing existing funding according to key factors, and setting up meetings with existing funders to eliminate barriers can be effective. So funders talking amongst one another to see how these barriers can be lowered and create a more equitable system for delivering, for creating RFPs and also for delivering funds. Professional development and capacity building, providing professional development opportunities that address competencies desired by organizations and individuals, such as social media marketing, grant writing, and birth equity work will help organizations take their work in new directions, streamline time-consuming tasks, and save precious resources. So we're excited to launch our first cohort of our grantees, and which also includes actually our grant applicants, which will be working with the Resilia platform in doing just this, right? Providing them with capacity building and professional development for themselves and their businesses. Collaboration and connectivity, increasing connectivity between birth equity workers and organizations and resources is crucial, but barriers such as lack of knowledge and capacity hinder this process. The convening to support the partnerships, boots on the ground marketing, and a centralized database of birth equity workers and resources are some suggested solutions. So I know personally, I utilize email lists of people who have applied for things and such in order to circulate opportunities, whether it's grant opportunities or opportunities to do some sort of advocacy or any of those, or contribute in some way. And these are some of the simple ways that things can be done, but it can also be done on a larger scale to encourage that connectivity and knowledge sharing and capacity building. Public awareness and communication, establishing a diverse communications work group to increase awareness of Nurture New Jersey and engage communities most affected by birth inequities and planning and implementation. This work group should prioritize transparency and accountability to promote trust and collaboration and establish a continual feedback loop between the state and the workforce. I think that this is something that certainly is in process, and something that individuals and organizations are thinking about how to strengthen that effectiveness of Nurture New Jersey. The Alliance is involved in and working on the process of getting a Nurture New Jersey director hired that would connect to communities and between organizations in order to help push this kind of process along. So we're very excited about that process as well. So with that, we have gotten through the research. That was a lot. I know. There's a lot of information. With that, of course, you want to take a few moments to ensure that you can absorb that and talk amongst yourselves about your reflections on it, what came up for you, what ideas you have about anything presented here. And so looking at the findings of this report, what else or more would you like to know from research of this kind? And what is your practical recommendation for funders in New Jersey around this? So I will put you all into breakout groups. Let me stop the share here. I think I have different questions for you. Those questions are not the right questions. But either way, I'll put you in the groups and then I'll jump into the groups to share the questions with you. So just give me one moment as I do that. Please feel free to talk among yourselves as I put you into groups. Okay, this is my first time doing this, so just give me a moment.
Morning, everyone. This is Dr. Muta from Amaka Consulting. I don't know if anybody had any questions for us while Cecile gets the breakouts. I don't think we'll be joining them, so I wanted to jump in, see if anybody had any questions for the work that my team did. Thanks.
Are you able to share, Lisa Block from the Healthcare Foundation, New Jersey, a regional funder in the greater Newark area? Are you able to share the list of participating organizations to help us so that I could see in the geographical area which organizations participated?
Yeah, I'm sure we have that. I'm not sure if it's an appendix in the report we submitted, but we have it, and we can get that across to you, Lisa.
Thank you.
Dr. Mutsa, do you think you could kind of share with the group what for you might have been the most surprising thing you learned in the process of the evaluation?
I think two things that stood out for me. One was like a general lack of cohesion and a lack of awareness around existing resources for some organizations. And not surprisingly, a lot of the smaller organizations felt really under-resourced. I think there's a real opportunity there. And two, just how much opportunity there is across the state to strengthen linkages and to build on people's goodwill and excitement. I think there's a real moment happening in New Jersey. And I think, we have an obligation to build on this window that we have. So I think those are two things that stood out, like a general lack of cohesion around what's existing, how do you access these services, how do you penetrate what's already there, and then how can we build on and improve these relationships and linkages? Because, Jersey is like 3 states. And so how do we get South Jersey to Central Jersey, North Jersey? But there's a real opportunity. And frankly, with the support of this group and what the First Lady's office is trying to do, I think we could really put Jersey on a map and get our rankings up, in maternal mortality. So thanks.
Yeah.
That's so helpful, and just drawing that out a little more. And thank you. It's just so great to see it all in one place together. And Cecile did such a great job with all of the good work you did. Can you give an example of like what those resources are that organizations aren't availing themselves of, right? Like, I'm just trying to think specifically about, what they're missing out on.
So I don't know if you've read the full report, but we outlined that in a recommendation section. But just off the top of my head, I would say like grant writing support, a lot of the smaller organizations need capacity building assistance to go after funds. So how do they access the resources? How do they build out their infrastructure financially in the back of the house to make sure that they're competitive, they're being fiscally responsible? I think they benefit a lot from some pro bono grant writing and research and evaluation.
And you think those resources do exist, though?
They're there, they just have to avail themselves. Like, so for instance, with one of our other clients, we entered into a contract with them to provide some capacity building for a bunch of small nonprofits. And they just contracted with us for a pool of hours. And a nonprofit will put in a service request or a technical assistance request. We'd honor that. Can you look at a grant for me? Can you need it? And then they could draw down on this set of hours, and then we could help build their capacity in that. So that's what I think would be nice, is to be able to avail themselves of, they don't need a full-time in-house research and evaluation person, but an opportunity comes up, do we partner with? How does this look? How do we craft this out? Particularly if you're going for federal funds, NIH is a whole labyrinth of how to even, you know what I mean? So
Totally.
Capacity in a way that's strategic. But we've done that for other partners, is to put like a bank of hours, if you will, and then community-based organizations can pull down on that and we can work with them. That feels like a piecemeal way to build their capacity until they have the millions of dollars to be able to get somebody to sit in their organization full time.
So it's almost like making sure there's almost like a directory or a repository of these types of resources that people don't know about but could be using. Thank you.
Sure. Tashira, is that for me?
Yes, thank you so much. Tashira, go ahead. And then once Tashira is done, we're gonna open up the rooms for you all to go and have conversation. Tashira?
Oh, good morning. I just wanted to share that, I wholeheartedly identify with the experience of being a small CBO in South New Jersey, and in the Atlantic City area, where there are great health disparities and challenges. It is very, very difficult when you are a small organization and you don't have the bandwidth or the manpower, and you don't have the resources financially to secure staffing. And a lot of times when you go after these funding opportunities, it's overwhelming. It's very overwhelming. And it's also, it almost makes you feel like, is this the red tape that keeps us out of the gate? Is this the red tape that we can't interpret? Sometimes it's another language that these documents speak. And when you are grassroots and boots on the ground, where you are not a larger system, for instance, down here is Atlantic Care, is Southern Jersey Perinatal Cooperative. These are organizations that everything is tiered, everything has to go through corporate. And then when you go into the community, the people don't know who they are. The people have no idea how to access resources. But then you have a small organization like mine that, will make house calls at 2:00 in the morning when someone found my number and there's a mom that's, overwhelmed and going through a difficult time postpartum. So having these opportunities to build out and to access this funding it's vital. It's not vital to the organization, but it's vital to the community and the people, the constituents who rely on us, and literally, not to sound drastic, but will die without us. And the number that. So thank you, Doctor. I very much could relate and identify with your comments.
Thank you. Well, I just want to say a couple things. I don't know if everybody here knows, but I'm a Trentonian. And so Atlantic City is very, it reminds me of Trenton, and that there's a lot of need and a lot of opportunity. So thank you for your work on the ground. I was just talking to my team yesterday. We have a client here that contracted us, a startup organization in the tech space, but in the maternal health space, that contracted with us to write a grant for them. They're going after some NIH funding. The capacity is not there at the startup or the small CBO level. And so they contracted with us, but at the end of the day, they brought us in because they knew we had the expertise. And so we just submitted 2 large grants for them, and we did it soup to nuts, right? We talked to the project officer, we drafted their documents, we got their resumes into the NIH format. Like, that's the capacity building that needs to happen so that you can continue to do the day-to-day work. And so I just wanted to thank you for your work every day. I wanted to also say that I totally sympathize with what's happening in Atlantic City area. I know the area well, and I think there's a lot of opportunity there. And you know what you're saying about how that translates to saved lives and saved opportunities. You should not be worrying about how to put together a bio sketch when a grant comes out. You should be able to tap into resources that are available to you and say, I have this request. It's doing 6 to 8 weeks. Can you get me a consultant or someone that can help take this off my plate? You should be providing direct services and doing the incredible work that you're doing. And you should be partnering with organizations like a market consultant, like others that can take that off your plate easily, but also have the contextual experience to make sure that your grant is competitive and gets funded. So thank you for your work.
So I just want to second that, Dr. Amutsa. There is a very recent funding opportunity that HRSA just announced that's like exactly, I think, what we've been waiting for a long time, which is government funds to support integrated maternal health services that are community-based. And then there's a screening and treatment for maternal mental health and substance misuse grant opportunity. And I have been thinking, like, how do we provide community-based organizations with the support they need to submit this application? And great to know that there are technical assistance providers like your organization that could be available to support those organizations. So I think this is something that the New Jersey Birth Equity Funders Alliance really wants to think about, because I know also from CHAP's perspective, we really see our role as helping to connect community-based organizations and more sustainable government funding. And this looks like this amazing opportunity. I don't even know where it came from. And we've been in touch with the Maternal Child Health Bureau asking for this very thing. And it kind of quietly came out. And, you know, now we feel like, how do we help organizations get that in? And I also just want to alert people, there's a New Jersey-based opportunity for a peer-led model, because we heard that there are lots of folks who are not accessing mental health services or substance use services. There's lots of good reasons why people are not comfortable with the status quo of the existing system of care that hasn't necessarily served Black and Brown families very well. This is a different approach. It's really training peers to address perinatal mood and anxiety disorder in a much more safe and congruent fashion. And so we're really excited about this opportunity that's coming out of the Department of Health.
Very nice. Very nice. Yeah, I think there's a lot of things that are happening, and I'm not surprised that HRSA dropped in the middle of the night. I used to work at HRSA. That sounds about right for the federal government, but there is a mechanism to you know, there's a certain language, if you will, that these organizations speak. So I'm glad it's out in the street, and I look forward to hearing. Cecile, I'm turning it back over to you. Thank you, everybody.
No, the conversation just flowed. So I said, well, I don't think there's a point of going into a breakout group. We have a small enough, more intimate group that we can share our thoughts and just think about some of the solutions as has already been given, and just really talk to each other. So I put the 2 questions in the chat. Okay, thank you for joining. I put the 2 questions in the chat. So, resonating with your experience, does this resonate with your experience as a CBO, if you are, or of any CBO that you know that is operating in New Jersey? And also, let's talk about some solutions. What are some solutions to the challenges that are being faced by CBOs? What have we seen already being done, whether it's in New Jersey or somewhere else, and how can we integrate those things into our processes? So feel free to jump in if you have anything to say, any comments.
Okay, I'll jump in. I have a big mouth. Well, first of all, thank you again for bringing this work to light. I think that the data is very helpful, and I'm so glad that there is more data being collected and more landscape analysis being done. There are a lot of resources in certainly in Greater Newark, but I still find that as much as there aren't that many funders in the space, and we haven't been seeing proposals where I'll call it responsive, but in this post, or emergent COVID environment, the dynamics, I think, have been such that a lot of organizations are just have been dealing with the crisis, and you need, oops, I lost you on the Zoom. You need to flip the switch and put yourselves out there to cultivate and engage. And that's what I personally started to do, to not only educate the staff, but to bring this to the board. Because, you know, we know high level, but we need to, I need to bring information about the community and provider communities to the board to help them really understand where, what the needs are, what does this mean? And so this is really important, but I don't find that there are a lot of funders. And so that's something that is on my mind. And certainly I think there's opportunity that I would try to leverage within my own organization. But, you know, I've heard from some CBOs recently with very strong leaders, it's hard to just have unrestricted support and grow their operations so that, you know, they know what they want to do and it's essential, but just to have that base of funding has been challenging. So we need to take that story forward as well. Unrestricted, general operating, multi-year, that's those sorts of things. In terms of mental health, I think I will connect you to more organizations that really have the cultural competency and the access and the affordability. There are some hidden gems out there that are just so busy, and I think there's more we could do for them to increase their staff and maybe focus on this particular issue. So all in all, this is giving me a lot of ideas. Funders should offer their services, generally speaking, and be technical assistance providers. We can, I think, do a lot. We do it one-on-one, and any group that comes in, we work with them so closely to drive success for them. But I think we could open the door and, you know, be more of a consulting resource, pro bono. And I personally volunteer myself for that.
Well, Lisa, I definitely feel that this is one major barrier to small CBOs in South Jersey. And when I say South Jersey, I'm going to specifically point out Atlantic City and Cape May County, because Trenton is also South Jersey. But not having someone to hold your hands, not having someone to interpret the language and to be able to properly disseminate exactly what it means with this grant funding. How do you go about implementing the structures in the community that actually give the services and the supports that people need at the grassroots level? For instance, Atlantic County, there is a high need in the mental health area, and because of substance use challenges and the lack of access to care and support, and then the fear factor. That is another issue when you find mothers and families that are in need of help, you know, food, clothing, mental health support. These are tangible that we're not talking about, oh, they need a stroller or, you know, they need diapers, things that, you know, literally you can't live without those things either when raising a child. But you're talking about the infrastructure, a family that is broken, and people are fearful to come out. They're fearful to ask for help. And then they're also fearful of what does that look like if these organizations or if persons get close enough to my situation. It becomes vicariously traumatizing to an organization that's limited when if you only have a grant of $5,000, or let's just say $12,500, it goes very quickly. And then you're forced to have to figure out how do you continue to serve in the community. There's just not enough to go around. And then just taking into consideration all of the other moving parts, the time, you know, a lot of times when we're small organizations who, you know, don't have access to a plethora of funding, you're working with 2 or 3 people that are literally working off of volunteerism. You know, I volunteer for my organization. I don't take 1 penny because my community literally needs it. Even if I thought I could afford to, or if the board could afford to give me a stipend for gas or just for my time of doula care, I can't afford to because they need it. Me taking it although I may be entitled to it, means there's less to go around. And then what happens when it's over, when the people call you and you'll have to tell them, well, I'm sorry, but at this time, we're not able to support you, and we'll, reach out to us in 3 months. We don't ever want to give those stories. So I think, in gist of what I'm saying, to wrap it up, if we could have some mechanism of continuity to pull us together with resources that are continual, where one ends, another begins, and then having pro bono support to be able to help us navigate so that we know the language, so that we are not spending time and energy on filling out applications or even getting scared by them when it's 10 or 12 pages. And then when you see your operating budget has to be at least 50,000 a year, you've barely cleared 20. That's overwhelming. And so the pro bono support is definitely needed, as well as a lot of hand-holding, if you will.
Mhm. Maybe we need to mobilize some more pro bono
Yeah,
service.
and that
Even
continuity
as
is here,
even
for
as
sure.
just as individuals, even. But I love the idea of doing something as an institution, but and I certainly can, present things like that. But at the same time, let's not lose opportunities to help organizations now while there are opportunities, and it's still in this kind of, being nurtured and developed, expanded, the whole movement. There's still a lot of people I find who, even I guess I want to say this because from my recent webinars that I've taken all this week, Black maternal health, there's, there's still a lot of education needed within the community itself. I'm happy so many people have joy and good experiences, and doctors feel really good about what the care, but there's still some disconnect to the data, to the realities for many people.
Mhm. Absolutely, and I totally agree with connect care. Those mechanisms for continuity are very critical. I did want to give Christina space to speak, because I know you were raising your hand. So
Hi, Cecile. Can you all hear me okay?
Yes.
Okay. I'll just be quick, but I was really glad to be on this project with Amaka, both as a research associate, but also as a community-based organization that I co-lead in Massachusetts. And I wanted to add something, like looking at these results from this landscape analysis was so meaningful for me, because both my analysis brain and my CBO brain lit up a lot of times. And I think in some ways we know a lot of the things that we found, right? And we know that the philanthropic and grant landscape was not made with the grantee in mind. And I just wanted to offer one thing that hasn't come up a lot. And I was a little interested, it didn't come up a lot in the results, but I think it's possibly a little bit of like, you don't know what you need until you realize what you need. But one of them is legal support. And so we're lucky to be with Boston College Community Enterprise Clinic. Our organization is, and I imagine there's similar academic organizations in New Jersey, but to give you all an example, the federal funds that we were talking so critically about earlier. So if you don't have an indirect rate negotiated with the federal government, you default to a 10% indirect rate. And so federal grants fund my time at my organization, and that 10% does not even cover the taxes and fees for us to run the payroll for my salary. So we actually operate at a loss for having, obviously my time is funded, which is important, but we actually, the indirect rate, the over and above operates at a loss. And so when we started to look into how you negotiate a better indirect rate, some of these academic medical centers in Boston, for instance, have indirect rates of 80%, 80. So 80% versus 10% is like a true David and Goliath situation, and they have in-house counsel to do that for them. So our community enterprise clinic is going to take this on for us, and they said there's 28 steps involved in applying. And when I heard the leader earlier from South Jersey, I'm like, talk about daunting, right? Like nobody has a law degree that on top of running a CBO, you know? And so I just want to lift that up too. It didn't come out as strongly in the results, but it's always there in the background, right? And I think if we start to talk about the structure and the system and changing that, legal support is going to be a part of that. And I just appreciate the time to share that.
Thank you so much, Christina. That's such a critical share. And I understand that having that both hats on to be able to see it with a really holistic view, I think that that's, we can't discount that, that view and that understanding that we get from being able to see things that way. And definitely legal support is something that the Alliance has been thinking about ways in which to nourish that conversation among community-based organizations and how they can receive that support. One thing that we became aware of recently was the medical legal partnership in New Jersey, where community-based organizations will write that into their grant to ensure that there are funds available for that in the grant, so that organizations can have access to that, and community members can have access to that knowledge and information for their services. And so that is something that we're definitely, we want to uplift in the coming months and connect CBOs with. So thank you for saying that. Does anyone else have anything that's pressing on their minds around solutions or anything that they see or have heard or want to discuss? We do have a few minutes. I see that the Office of the First Lady has just entered, so they'll be getting started in a few moments. So if you have any last minute thoughts, feel free to jump in.
I was just going to say, this is a really helpful conversation for us as we really try to think about stewarding the resources within the New Jersey Birth Equity Funders Alliance. And thank you for sharing the legal resources and the grant writing resources, and you know, just kind of for sharing your experiences. I think that will be it's really important information for us as we try to set our priorities for the funds that we're stewarding together.
Yes, thank you so much. So we are waiting for the for Office of First Lady to jump in. So what we'll do while we're waiting is just take a few minutes of break. We've been talking for a while. You can get some water, use the bathroom, and come back in 5 minutes. We'll say at 11:10 and wrap up our conversation, and then jump into the closing remarks. Okay? Thank you all so much for this. Whenever you all are ready, then jump back in. I think we have time for maybe another question or comment before we can be ready. Ready to jump back on, feel free to do so. We have another couple of minutes for First Lady shares her reflections and talks a little bit about Nurture New Jersey. All right. So I would just say, if there's any final wrapping up thoughts, anything else, you have your space of about 3 minutes or so to do so. Any questions you may have, etc. Feel free to add.
I was just wondering if Tashira wants to put in a plug for the presentation she's giving today at 1 o'clock.
Oh, okay. I did see that, the advertisement too.
Maybe she's
I can do that. I am so nervous, y'all.
Oh, I get it though, but you'll do just fine.
Yeah, the more I look at the clock and the more time passes, it's like, yikes. But I can get that in just one moment.
If you have the link, you can certainly share it in the chat. But definitely would love to learn more about it. Even though I've seen the flyer, I'm sure others would love to learn about it. Looking for it, perhaps. I know sitting in silence can be very uncomfortable, but this is good. It's good for your brain. All right, wonderful. So now we are going to be joined by First Lady Tammy Murphy to close us out and speak about her initiative, Nurture New Jersey. And we look forward to hearing. Thank you.
Well, good afternoon, everyone. Cecile, I am grateful for your leadership and your partnership. And I want to thank everyone at the Birth Equity Funders Alliance for their incredible work, commitment to New Jersey's mothers and babies, and of course, for the invitation to be a part of today's event. At this point in the program, I am sure all of you are aware of the critical research the Alliance has done, and I would be remiss if I did not recognize a few of the organizations who have worked together to make today's findings possible. Amica Consulting and Evaluation Services, who conducted the research, community-based organization leaders, other community leaders and members, and the New Jersey Birth Equity Funders Alliance Community Advisory Committee. Through Nurture NJ, our administration's maternal and infant health initiative, we are working in partnership with all of you to solve New Jersey's Black maternal and infant health crisis and to transform our state into the national gold standard for maternal care. Our blueprint for reaching that goal, the Nurture NJ Maternal and Infant Health Strategic Plan, takes a comprehensive approach to improving maternal and infant health outcomes and really requires all sectors, including medicine, business, academia, transportation, housing, and many more to play a significant role. Within each and every one of those efforts, there is a particular need for comprehensive, relevant, and timely data. When our administration began in 2017, we were working in a maternal health data lag. At that time, our latest maternal mortality report was dated between 2009 to 2013. And even though it was obvious that New Jersey was in a maternal health crisis, one that largely affected mothers and babies of color, it was not until 2022 that our Maternal Mortality Review Committee was able to process data relevant to the work of Nurture NJ. With up-to-date information, we can create policies that are informed by reality. We can direct our strategy to target specific goals. And most importantly, we can measure our performance and make essential revisions, change direction, and just learn from our experiences. Two of the most essential data-driven tools that we have in our strategic plan are our Maternal Health Hospital Report Card and our Maternal Data Center. Our report card, created for each birthing hospital in the state, will provide an annual assessment of every hospital's maternal health performance and delivery outcomes based on selected quality of care metrics. This report card will, of course, be used to inform Nurture NJ on whether outcomes are improving across the state, and is also publicly available as a dashboard so that families can make informed choices as to where they choose to deliver their babies. Speaking now as the mother of four, that kind of transparency.
Expensive stuff.
Sorry. Oh, okay. Sorry, I was saying as a mother of four, that kind of transparency is priceless, I think, for any mom faced with the countless high pressure decisions that come with even the healthiest of pregnancies. The legislation to establish the report card was signed by my husband, Governor Murphy, in 2018, but we knew we needed an entity to be able to process our state's maternal health data and to bring our goal of making it public facing to fruition. So in 2019, Phil signed further legislation to establish the Maternal Data Center. The center will be able to rectify our data lag problem and provide timely data regarding morbidity, mortality, and racial disparities to hospitals, all relevant stakeholders, and to the public. And it will also help us track our progress, informing us when we reach important benchmarks and, importantly, identifying potential opportunities to change direction. These are just some of the most important ways that we can use data to make New Jersey a state where every mother and baby begin life together in health and safety. But I would be remiss if I did not also share one further use for this data. For 5+ years, I've repeated one group of statistics in every set of remarks, every op-ed, and probably every single interview I have given on maternal and infant health. In New Jersey, a Black mother is almost 7 times more likely than a white mother to die from maternity-related complications, and a Black baby is nearly 3 times more likely than a white baby to die before his or her first birthday. As a mom of 4 kids, no matter how many times I repeat those numbers, I cannot help but think, but for the color of my skin, that could have been me. While data has the vital ability to inform smart policies and help us design targeted strategies, it also has the power to tell a story. Each of those statistics represents a real mom, a real baby, and a real family whom we have the power to help. Today, the research done on behalf of the Birth Equity Funders Alliance also told an important story. A need for more resources, greater access to housing and affordable childcare, and a significant need for collaboration and coordination between state agencies and community-based organizations, among others. We all agree that strong families are the foundation of a healthy society. Seeing ourselves, our own mothers, our aunts, our sisters, our daughters, and community members within this data is an important motivating factor if we seek to make changes that will save lives as urgently as possible. With that said, I am incredibly grateful to the Birth Equity Funders Alliance, all who contributed to the research presented today, and to each of you who are present. And before we close, I would like to share a bit of good news. According to the March of Dimes report card, which was released in November, of the 53 states and territories evaluated for maternal health, 47 declined. 1 stayed the same, and just 4 improved. Kansas, Montana, North Dakota, and you guessed it, New Jersey. This marker is a testament to the transformative work we have done over the past 5+ years, and to the incredible outpouring of support we have seen literally up and down the state. So, as we recognize Black Maternal Health Week, I really want to thank you all for the opportunity to share this message, as well as your commitment and partnership on behalf of New Jersey's mothers and babies, especially our mothers and babies of color. Conversations like today's are essential to raise awareness, elevate the stories and experiences of Black women, and identify challenges and solutions. As we continue our work, we are constantly reflecting and assessing the effectiveness of our policies. So I welcome the contributions shared today, and I'm grateful to be able to count you all as our partners. Our work is beginning to move the needle, and together we will make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. Thank you so much for having me, and apologies for the delay in getting here.
Thank you so much for your remarks and for the work that you have helped to push forward in the state of New Jersey, and for your partnership. Thank you so much, and have a wonderful, enjoy the great weather outside.
Yes, I hope all of you do that as well. Thank you.
Take care.
Bye-bye.
Right. So with that, we have come to the close of our conversation. I hope that this was really useful for you, and that you'll be able to utilize it in making shifts and changes in the way that you do your work. And of course, you'll be hearing more about the Birth Equity Funders Alliance and how we are shifting and doing our work from this information. And so with that, as I said, enjoy this weather. It's a long time coming. And hopefully we'll see you again soon at another presentation, which will be several, actually. We will be at the Council of New Jersey Grant Makers talking about participatory grant making in May, as well as the New Jersey Public Health Association conference next week to discuss this research as well. So definitely looking forward to having you all and seeing you all there as well. And take care.
Yay, Cecile.